Hello, everyone. I'm Dr. Gerald Maguire, founder of STARS. I'm the host of our STARS podcast, STARS Speak, Understanding the Science of Stuttering, where voices are heard, understanding of stuttering grows, and awareness moves forward. Each episode features unscripted and honest conversations with researchers, clinicians, and individuals dedicated to advancing the science, treatment, and understanding of stuttering, a field that deserves greater attention, collaboration, and research. Well, I'm happy to be joined today with my colleague for many years now, Dr. Lisa LaSalle. Lisa, maybe tell us a little bit about something about you, what you do, and what you've done in the field of stuttering.
Absolutely. Thanks, Jerry. Thanks for having me on. I think we go back to my time just looking at being a clinician and researcher in stuttering. And I've gone to some of your talks over the years. Right now I'm at at California State University, Monterey Bay. And this is, the third place I've been doing. Right now I'm in a new program here where we've been graduating our fourth cohort of students in a pretty young program for a master's. So, and I've specialized in stuttering for many years. So I can tell you more about that, but
we will.
So exciting.
Oh, that's great. Well, thank you, Lisa. So you do research as well. We've collaborated on research, and you do education. So part with Cal State University Monterey Bay, you founded that program, correct? You started the first group of students.
Yeah, I would. My colleagues, Dr. Carrie Chitwood and Maria Jose Flores, are the real founders, and myself and one more faculty just joined 3 years ago. So we are. That's great. It's been exciting in this area of California.
Which is a beautiful area right in the central state. And would you say we have a shortage of individuals who understand how to treat stuttering? Would you say there's a shortage of that?
Absolutely. Absolutely. And I think one thing that we can think about too is how across the board, some people have described it as a pendulum swing of, nature, nurture, where there's just so many different options. And I think that's one of the most powerful things about stuttering is the complexity of the human condition of it, and then also all the options for different types of treatment.
Right. So you've dedicated more than 3 decades really focusing on stuttering and other communication disorders, correct? And could you take us back to what first drew you to working in this field?
Like many, when you're in college, I was a philosophy major, and then my mom, who was a very practical nurse, said, hey, I've heard about this field. We didn't even have the word language in it then, but it was this field called speech pathology. And that piqued my interest because my dad stuttered and had always struggled with his stuttering. So I had that compassion for what he'd been through. He went through the Hollins College program in Virginia, where it was Martin Schwartz thought he had solved stuttering at that time. Stuttering Solved was, I think, the name of Marty Schwartz's book. And so I still remember those days of just being a kid along with my sister and watching my dad, kind of talk into a decibel box. It was like a red light came on if it was a block. Duh, he already knew that. And then a green light would come on if he did this kind of talking. So kind of seeing that it wasn't great for my dad. He actually relapsed after that program. And then I found my way into University of Virginia, and for really loving working with children instead of the preschoolers. So Susie Myers-Fosnot was my mentor at that time in 86 to 88, and she really helped me get on my way into the stuttering research of the field. I remember looking at transcripts of little ones. So kind of, from the adult to the prevention of children has kind of been where I got started.
Yeah. So that's almost like a calling, this passion. You saw this firsthand as a child growing up.
Yeah, exactly.
Yeah.
And I think so
Yeah.
many students who come into our field have had some kind of have been touched. Either they themselves have stuttered or still stutter, or they have had someone in their life, they know about it. Um, yeah, and then I have to say too, from Susie Myers-Fosnot introducing me to Ed Contour, who's had such an amazing career, and being at Syracuse in the early days of some of his research in the field. So
Yeah, that's interesting. You bring this up that I think it's one. We look at the struggles that people who stuttering that we do face, and your clients face with your father. But there's one thing I'd say that, at least for my role as a clinician, also as a teacher, as you are, is that people who stutter can go into our fields to help other people who stutter. Right?
true.
People could go into the field of speech language pathology. They can go into medical school. So I think in one hand, as let's say a group that is challenged, we have that benefit in that people ourselves can get to this point to help other people. It's not true of but many other conditions that people may struggle. So I just think when we think about like a
Yeah.
positive way, because I view that as where people in this field, the field that you and I do, for the vast majority of us, I think there's a passion for this.
Yeah, and there should be, right? If you think about disability movements over time and thinking, I mean, I really love that phrase, nothing about us without us, right?
Yeah.
And many times as normally fluent, persons who do not stutter, to take that step back and really understand from people who do is a critical piece of what we do. Yeah.
Yeah. Well, you and I have been talking about this, let's just say this vision of stars for quite some time, huh?
Yeah.
Right. And so you're a founding officer, right? You're our treasurer, right? So thank you so much. We've worked so many years together in a collaborative model. What drew you specifically to, what do you do with stars, and what is stars, and what drew you to us together putting this organization to where it is today?
Yeah, well, I think, we're still, this is early stage for us, and that's what's so exciting. I love being part of early stages because you can really choose the path and be, again, sitting back, listening to those who want to choose their own path. There's a lot of people who stutter in stars, which is one thing that drew me to it. Your own experience stuttering. I still remember, Jerry, when I first got to hear you talk in different places in California, the childhood, the Cal State Fullerton was doing that annual talk, and I think they still are. And so to hear you talk about your own experiences. So I think that's one thing that drew me, is the people, is you and the rest of the group that is just, and then the second thing would be the interprofessional. I mean, ASHA, American Speech Language Association, they preach, the whole interdisciplinary, how important interdisciplinary is. But it's another thing to live it out and to actually say, oh, I want to hear from a pediatrician. What is it like for them? What's it like for a psychiatrist, looking at all the medication possibilities? What can I learn from, we have psychologists involved, right? We have counselors, we have people who stutter and who are, psychologists who have come to different talks that we've done. We just first had our first conference last year, so very exciting.
We're having more this year. We're getting a team together here soon too. So you bring this up, the interdisciplinary. Speak to that a little bit more, because you're taking the lead on this, right?
Yeah. We're at a stage in our field right now. 2026. We look at where the field has been, and we need. I think of it as like yes and, like an improv thing. I'm sorry. It's like, yes, you want self-help. And when you are really struggling through your stuttering, did you also know that there's a lot known about the brain and brain imaging and options and fluency shaping along with stuttering modification, good old Van Riper therapy. Did you know that people are doing that right now? SLPs are offering that service. How about what's going on with medication? Do you know about that? What medications are you already on? What does that mean about dopamine antagonists? We can talk more about that. But I think those are things to me that it's like the whole gamut of options for people. And I think interdisciplinarity brings that. If you are just going to, and there's wonderful things around the country, but if, let's say, you're only going to a camp about stuttering and you learn that you're not alone, that's powerful. And that's one of many other things that are also available to you.
I see.
So I think
And
that's,
also,
I think that's where we're at. Yeah.
right. And also, stuttering can coexist with other conditions. Am I correct? Like there are other conditions.
Exactly.
So
Exactly.
maybe just speak
Yeah.
to that a
Yeah.
little bit.
Yeah, being in a teaching university and doing research out of Hyde, I like to say, I love research, but I certainly haven't had like a trajectory like someone in an R1 would be. Instead, I've gotten to do a variety of different types of research. And one area that I've really delved into with my colleague Leslie Wolk has been phonological disorders co-occurring with stuttering. It's as high as 40% in the little ones. It's like 30 to 40% of these little ones, when you work with them, they are also struggling to be understood. Nobody knows what they're saying, and it could be motoric, language-based. There's a lot of really interesting pieces to the phonological side. So treating those kids is a labor of love, because you've got to be like, okay, we know about both disorders here. Let's try to cycle through the two of them and help them. Some kids, the more they're understood by others, the more fluent they become, because people get what they're trying to say. Some kids, you shake up their phonological system and the stuttering gets worse for a while. You got to return and treat the stuttering. So it's a very interesting area with the preschoolers, even into school age. There's kids who still, I don't know if you've seen this before, but kids who say, they're on playing a video game and they're being teased more for their R, than they are for their stuttering, like, because they don't say their R right. So it's like somebody needs to treat that too, right? So it's the whole idea. But I think concomitant disorders is huge. It's mostly phonology, but it can be ADHD, right? You know about that from meds.
Yeah.
It can be, there's a whole lot out there. So yeah.
And then the work of Dr. Kikuchi, who's our secretary, talks about social anxiety and the impact of that.
Right. Absolutely. So anxiety is huge.
Right. And so what's interesting, when I go meet with a group of psychiatrists, right, and just at this one meeting said, do you treat ADHD? Oh, yes, all the time. Do you treat social anxiety? Oh, yeah. Well, so many of my patients have that. Do you treat stuttering? Well, I don't know. No. Well, we've labeled it. So it's like this, seems like I got this group treating these conditions. We have this group, right, focusing on ADHD, social anxiety. And then I've got our colleague speech pathology working over here. But I'm not aware, I look at other programs, say Tourette's programs or programs with ADHD, working closely with, say, psychology and education, working closely with the physician, working as an interdisciplinary team. We really don't have that model yet. We talk about it, but am I correct? I don't think it's there yet for stuttering. So I think that's part of our goal, right? Bring this together.
It's one of our goals and stars for sure, is really getting that, and even understanding, the whole, human conditions involve the whole body. We have Annie, who her research, which I think is so interesting right now, is, it's not in stuttering, it's in inflammation, but she's a person who stutters. And there's sometimes these interesting biological, physical aspects to the problem that are just can be overlooked many times. So
it can, so we look forward to that. And I got to say, it's going to take it takes a team, I think, to really fully address these complex conditions that we struggle, right? And I don't think one size is going to fit all. Correct?
Absolutely not.
That's
that's one thing I want my graduate students to know is, keeping the stuttering expertise in our graduate curriculum and understanding, the brain, neurotransmitters, and then things that are overlays, that are counseling, that are psychological.
And what would you like to say as a message that you'd like to give first, say, to physicians, maybe pediatricians, even psychiatrists, neurologists, primary care.
Yeah, yeah. We know the risk factors for
Okay.
children who will not outgrow stuttering. So for
Hmm.
pediatricians, I would start there. We are pretty solid on which risk factors mean that
Hmm.
this child is not going to, yeah,
Right.
it's not going to be a watch and see, wait and
Right.
see. It's going to be, let's refer that child now to an SLP. Let's
Right.
see what we can
And,
do. Let's
right. And what about the
get
other
that.
way around? When should an SLP refer to the medical side?
Very good question. I have
Yeah.
had many kids in my clinic recently. I mean, I would say all across my career, but that are on a variety of medications because they have a concomitant disorder. They're already on Focalin, or they're on this one, or a variety of different things depending on the condition. They are curious about like what is the impact of, or they haven't even thought about,
They
what's the
haven't thought of
impact.
it. Right.
Right. They may be adhering or not adhering so well to these different medications. So that's one reason. Another one can be a variety of conditions that it's not in our scope of practice to treat, all kinds of things, anxiety, especially when these are clinical conditions that our scope of practice has plenty in it as SLPs, but it doesn't have, let's say, bedwettings when I come across a lot with kids recently, or different things that are going on that are like, okay, that is something where we want to refer, find out what's helped so far, what hasn't, go back to the pediatrician. There's a lot being talked about with trauma now with kids who've gone through a variety of different trauma-informed care. But we want psychologists, psychiatrists,
Right.
pediatricians,
Yes. Even talk about.
counselors,
Mhm.
family counselors, all of that.
Right. Perfect. Thank you. Right. Because that's when I look at the care of other adolescents, kids, adults who stutter, it's not just one. We're not just going to give out a medicine, and we're not just going to do the talk therapy. Usually, these conditions, and we need this research in stuttering shows that the collaborative interdisciplinary care leads to the better outcomes. And I think that's where STARS is. We're soon, we're hopeful to be in support. We will be supporting research in this area to really and bringing teams together. I think that's going to be one of our missions, partly only through our education, but to letting people know. So, Lisa, going forward, like what gives you hope right now, either in your own journey where you're doing this fantastic work of, training the next generation of clinicians? But what gives you hope right now, just in the broader world of where the field of stuttering is going? What would you say?
I think one thing that gives me hope, and we touched on this before, is really the autonomy of people who stutter, who have choices in what it is they may start with one type of help that they consider help, and then they're like, this isn't enough. I mean, think about all the human conditions we go through, right? And so I think one hope is when you see that you have choices as a person who stutters or a parent of a child who stutters, then you can exercise your choices. The other side of it is the options that we can provide as a team. SLPs have a lot of options to provide now that are eclectic. I like eclectic therapy as long as you know exactly why you're choosing this particular choice, not being, like we said, the one size fits all. I can show students how that fails, but I don't because of ethics. I show them how it succeeds not to do one size fits all, right? So when you treat someone and they can see that a blend of stuttering modification, referral to someone about what other things are going on in that person's life. Russ Menzies has a great like CBT free thing out there that we learned about when we talked years ago at a conference. Some of these resources are rich to draw from. You just have to find them, use them, see how they work. And I think the other thing that gives me hope, is that flexibility and compassion that our field has to see people who stutter down the path that they really want to take.
Yeah. So, all right. Well, thank you, Lisa. Yeah, even though I think our future is bright, and we still know that
Right,
there's a lot of there are challenges there. For me, one thing is access to care. Correct. Like,
right.
where do people go? But then, what do you see are also some of the unmet needs and the challenges that we face as a community of persons who stutter and as a field?
Yeah. That's a good question. I think over the course of my career, we've talked about this pendulum. It swung between too much fluency shaping. Now there's a little bit of risk of none at all. And it seems like good old Van Riper's stutter modification gets forgotten. And that can be that. I know you've said that's been helpful to you. And that's just speech therapy, right? And then given that we have evidence-based practice, that includes the informed goals of the client and the caregiver. And we can't forget that piece, right? So even while our evidence and our body of literature, burgeoning literature, it's great. We are getting a lot more out there on stuttering, but it's never going to be true that 100% of clients want only to communicate um, better and still stutter. It's like they want to be more resilient. They want to educate others about stuttering, but that's not it. That's not all there is. There's going to be more. And many individuals who stutter are still going to choose to work on their core behaviors of stuttering, the moments of stuttering, the feeling of a block. And who better to help, reach that goal than SLP is working on a team. So you can see I'm really got on my SLP bandwagon, but it is the thing that we are trained and should be continuing to be trained to do as a specialist, or if you're not a specialist in it, refer. So stuttering is okay, but if the person who stutters chooses easier stuttering, that is even more okay because that's what they choose and it is achievable. So I think that's the piece that is getting a little bit lost in some of what's going on today and options.
Yeah. And I think it's also to empower the individuals with knowledge, improve their access, and improve the education around the greater healthcare community. So that
Sure.
way, to me, I just see this as parallel. Like my colleague who does work on ADHD, he says, and he heard one of our talks, he was at our event and said, this is where ADHD was 30 years ago.
Yeah.
You guys don't get it. It's like, it's all this about the kid, this behavior. We could work together. It's like a team. And so we need to, by understanding more about the science, we're going to get breakthroughs and more people will come into therapy because we understand the science more and have a collaborative research. And I think we'll hopefully get those data sets, then we get good access to care because then we say, here are the outcome measures of working together. And I think the stigma is going to be less as we understand the neuroscience of it. Because to me, that's been very clear with anxiety, Tourette's, ADHD. There's tremendous stigma. But as we understand the neuroscience, I think it's better. So to me, that's bright, and we're working together on this. And I think it's to me, we both have the passion for this, and everyone at STARS does. So, so I think it's bright there with that. What just as we kind of wrap up a little bit, Lisa, what do you hope our listeners take away from the conversation that we've
well, I think with stuttering being a complex condition, we know a lot more about it, and we need to, I think, really have people see the different options. I think to me, it's the treatment options, particularly the physical, neurological aspects of stuttering, knowing that is like when I have students identify stuttering, I use, panels of people who stutter. That's key. That's what we get out of STARS. So I think that's one thing I want people to get is the diversity among people who stutter. Ed Contour used to say, people who stutter have just as much right to be different from one another as people who don't. Right? So it's kind of a funny way to say it, but so we, as long as they've got informed wishes about their stuttering, many of them do want the loss of control to be alleviated in some way, to feel some amount of control over loss of control, because that's key. Would you agree that's one of the key aspects of stuttering?
It is.
I love acting.
Right. It is. And so that's why I think sometimes I look at the coexisting conditions oftentimes, and even this, the ruminations, the obsessions about, this is going to happen, I'm going to do this, and just the fear. And so, to be able to master that moment and be able to, and it's just that anticipatory anxiety, the ruminations.
Right.
So there's a lot of work we have to do here. And we're going to learn. It's going to, I think as we expand knowledge and expand more trained clinicians who understand this from multiple disciplines, people's lives are going to improve. And we as clinicians, we're going to feel better because
Absolutely.
when our
Yeah.
patients and clients do well, we feel good. All of us
Yeah.
we're in the clinical field. Really, we're a service and we gain satisfaction from helping others. I think everyone
Absolutely.
is in this field is. So I look forward to that day as we continue to offer, again, as you said, informed choices. That's what's great about persons who stutter. We cognitively are an informed group. We can make that cognitive decision. And I got people email me all the time, and I'm getting hundreds of emails weekly with stars, and I got to answer these. It's a challenge, but people say, "What about this? I'm studying this and this." As a community, very informed, so we're going to empower with more information. And I thank you for taking that lead and educating the next group. Next, we're going to get your trainees together with mine, and we're going to get them together, and we're going to form this interdisciplinary generation of clinicians, and we hope to get that around the world. And that's really,
Absolutely.
I
Absolutely.
think so. Well, I want to. I really want to thank you so much, Dr. LaSalle. I think I'm so grateful that for our relationship as collaborators, as clinicians together, as researchers, as co-authors together. I thank you for being a co-founding officer with us at STARS.
Oh, the pleasure's all mine to be part of this group. It's been delightful. So thank you, Dr. Maguire.
Thank you so much. I appreciate you taking the time. And just for our listeners today, just let us know that if you have a question or topic you'd like us to cover, visit the Get in Touch page on our website, stutteringresearch.org. We'd love to hear from you. And don't forget to subscribe, follow, and rate our STARS podcast, STARS Speak, Understanding the Science of Stuttering. This allows us to reach more listeners and grow awareness about stuttering research and advancing therapies. And if you're a healthcare professional and want to learn a little bit more about stuttering and how to help your clients and patients, please take advantage of our free CME and CE credits, and other healthcare licenses can get credit for this as well. And that's through we're very thankful with our joint sponsorship with St. Louis University School of Medicine for that. So I thank you all for listening or viewing if you are. Appreciate your time. Thank you again, Dr. LaSalle, and we will see you next time on STARS Speak.